Bismillahirrahmanirrahim. Assalamualaikum to sir. My name is Puteri NurSakinah Shahridan. I'm going to present about forecasting the COVID-19 outbreak in Selangor using box Jenkins method. First of all, the COVID-19 word have a meaning where CO stands for corona, VI for virus, D for diseases, and 19 refer to the year the virus has been recognized. COVID-19 is infectious diseases caused by the recently found virus known as SARS-CoV or coronavirus. This virus started in Wuhan, China on December 2019 and started spreading in Malaysia on 25 January 2020, which is last year, from a Chinese tourist who passes through the Singapore. Then there are a few symptoms that affect coronavirus, that affect our body from the COVID-19, which is there are 3 stages, which is the mild respiratory complication. Stage number 2 is failure of various organ, and the last stages, which is the serious stages, which is death. Then we proceed to the problem statement. Okay, when this virus has been detected in our country, the first MCO have been implemented on 18 March. In the way to break this virus change, strong prevention steps have been taken, but the cases still increasing even after the lockdown. Box Jenkins method is being used in this study since this model is more better to forecasting in these cases. In our project, there are 3 objectives. Which is first objective is to apply the box Jenkins method towards the data of the positive recoveries and death. And second, to identify the best model in box Jenkins method, either Sarima or Arima models. And the third, forecast the future positive recoveries and death in COVID-19. Then, significant of the project, to estimate the forecast about the future mobilities, recoveries, cases, and the number of deaths in Selangor, and using using box Jenkins approach since it's suitable for forecast the large amount of time series. Benefit, it can help the staff of by locating and marking the hotspot that can cause the COVID-19 cases, increase time by time. And in the scope and limitation of the project, due to limited data, is high probability to get inconsistent results since we get data from the Ministry of Health. Then, in literature review, in this part, I will explain the few things that we use in a box Jenkins method. In box Jenkins method, it has AR, or known as auto-regression model, auto-regression, moving average MA, integrated I, seasonal autogressive integrated model average, which is SARIMA. Then seasonality, unit root test, auto-correlation function ACF, partial auto-correlation function PACF, AIC, BIC, and W Watson. In this section, the most important part is AIC, BIC, and W Watson. AIC is a common measure for evaluating the model to determine how well a model fits the data. For BIC, commonly known as SWOT criterion, to select the model that achieve the most accurate out of sample focus. For W Watson, it is a test for autocorrelation from statistical regression analysis. The W Watson statistic have value from 0 to 4. The value of 2 carries the meaning no autocorrelation, while the number of zeros start from 0 and less than 2, it carries positive autocorrelation, while 2 to 4 it indicate negative autocorrelation. That's all from part of introduction. It will proceed to the methodology and result that we present from Sarah. Thank you. Assalamualaikum.